30 right here on Love 101 FM, the family station, and it's now time for Family Time.
Good evening and welcome to Family Time. Family Time is your program about your issues, your relationships, and your topics. Now, Family Time is a program about family, and it's Family Life's ministry's aim to improve family life in Jamaica. Because if we have better families, stronger families, we're going to have stronger communities and a stronger nation. Join us today on Facebook and YouTube Live on the Love 101 Facebook page and YouTube channel. As I said, Family Time is produced by Family Life Ministries, and we want to enable healthy families, which will lead to healthy nations. So stay with us and join us via all the platforms. October is celebrated as Oral Health Month, and coming right off of Senior Citizens Month, we thought that we would marry the two. So, Grandma and Grandpa, how is your oral health? All of the great elders, are your teeth intact, gums healthy, disease free, is your breath fresh? What do you need to know about your oral health so you can eat and live happily? Not sure? Well, stand by. We're discussing that and more today as we look at oral health and the grams. As you think about all those questions, tell us, as an elderly person, how are you taking care of your oral health? WhatsApp, well, we can't WhatsApp today, but definitely call the studio lines at 876-968-8327 or 968-8328 to participate. You can also comment on our Facebook page and the Love 101 YouTube channel. And throughout the program, we definitely will be sharing your thoughts. The question again is, as an elderly person, how are you taking care of your oral health? Remember, you can watch us on YouTube Live and Facebook Live. We'll be right back with our guest, Dr. Leslie Davis. Don't go anywhere.
When we think of inflation, we think about the things that we can't afford as prices rise and the dollar struggles. But the flip side of our dollar doing less is foreign currency doing more. As the value of the US dollar climbs, investing in US dollar products can add a boost to your portfolio. With our low interest rate environment, savvy investors can secure attractive loans for real estate investments and favorable returns.
Visit barita.com/opportunities for more growth coach insights.
NIS pensioners, avoid the wait. Get your NIS pension straight to your bank account. It's easy. Simply visit the Ministry of Labor and Social Security's website, mlss.gov.jm, or the nearest NIS office and collect the direct deposit application form. Then complete the form and submit it along with supporting documents to the NIS office nearest you. Avoid crowds and long lines. Get your money when you want it. The National Insurance Scheme, always working for you.
Life comes at you fast and it can hit hard. Apply for the Credit Union Prepaid MasterCard from C&WJ with chip and PIN protection. Need a card with a personal line of credit for emergencies? We have that. Need a card you can use to shop online for that must-have item? We have that. The community and workers opt to make a prepaid MasterCard. All the convenience of a MasterCard. Discover the benefits of belonging.
Welcome back to Family Time on Love 101. And welcome too to our special guest, Dr. Leslie Davis. Dr. Davis is a dental surgeon and, in her own words, has a passion for education in dentistry and oral health promotion. She has a special interest in community dentistry, special needs dentistry, pediatric dentistry, evidence based dentistry, and dental research. She has practiced in Jamaica, Trinidad, and Montserrat. She's also a lecturer at NCU. How are you, Dr. Davis?
Morning, Tamaya. Thanks for having me. It is indeed a pleasure to share with your listeners as we start Oral Health Month this October under the theme Be Proud of Your Mouth. So I'm happy to share with you today.
It's so good to have you. Now, listeners, remember we want to hear from you. We need you to tell us, as an elderly person, how are you taking care of your oral health? Please call our studio lines at 876-968-8327 or 876-968-8328 to participate. You can also watch us and comment live on Love 101 Facebook and YouTube. Throughout the program, we will share your thoughts. Now, Dr. Leslie, may I call you Dr. Leslie?
Yes, that's fine.
Okay, okay, great. So, who in the dental world would be considered elderly?
Okay. Well, we define elderly as anyone who is over the age of 65,
Okay,
right? That would be your elderly.
okay. And what is general good oral health for any age range?
All right.
And is
Well,
it
good.
different for the elderly?
Right. Well, good oral health would be for everybody, whether
Mhm.
you're elderly or you're young or you're not so middle aged.
Mhm.
And it is more than a beautiful smile. It
Okay.
has to do with absence of any disease in any of the structures that you have in your mouth that you need to speak, to chew, to smile, yes. Also not having any pain and discomfort and being
Okay.
able to show up in the world with high self-esteem and being able to have a high quality of life.
Okay, okay. Now, I was actually pretty surprised to learn doing some research when my daughter was younger that your oral health actually affects, for example, the line, the how your spine lines up, and you can get back pains if your oral health, your mouth isn't properly aligned and so on. Is that so?
Hmm. I'm going to leave the back alignment to the orthopedic surgeons and the
Okay.
chiropractors. But in terms of the link between the mouth and the body, we know that there is a
Mhm.
connection, and we have
Mhm.
a large body of research to draw from. And
Okay.
this link is especially as it relates to, say, diabetes, which is a
Mhm.
disorder of immunity, and
Right.
also anything that has to do with the heart,
Mm,
or even having a stroke.
right.
Also, pregnancy has been linked to disorders
Mm,
in the. So, for example, you know that periodontal disease or gum disease,
right.
we tend to see a lot of that in our elderly population.
Mm-hmm.
And what we find happening because of that mouth body connection, whereas the gum disease would impact the particular chronic condition, and also
Right.
in the reverse, the chronic condition would impact the gum disease. So you're more likely to have a stroke or a heart attack
Mm-hmm.
if your
Okay.
gums are not healthy. And maybe
Wow.
the elderly are not having babies just about now, but
Right.
for those listeners who are of childbearing age,
Mm-hmm.
if you have gum disease, you're more likely to, miscarry or to have a baby
Mm.
that's
Wow.
underweight or a baby that's premature. And
Mm-hmm.
if you have
Okay.
gum disease and you're a diabetic, the gum disease can make the diabetes worse, and also the diabetes has a negative impact on the gum health.
Okay. Okay. So, what are reasonable expectations for normal good oral health in an elderly person?
Well, the first thing I would like to say, back in the olden days, it would be normality for you to, as you get older, you would lose tooth after tooth after tooth until you are actually toothless. That does not have to happen. And
Okay,
I'm hoping some of our younger listeners are taking heed,
right.
putting in the efforts to maintain good oral hygiene now will help to maintain your teeth for a lifetime. So
Okay,
you can keep all your teeth up until you're well up in age. And that's if you pay attention to them by seeking regular dental care and also if you practice good oral hygiene.
okay. I just want to remind our listeners not to forget to share your experience. As an elderly person, how are you taking care of your oral health? That's our social media request of you this evening. So please uh, call us on our studio lines at 876-968-8327 and the 968-8328 to participate. Also watch us and comment live on Facebook or Love 101 Facebook page and the Love 101 YouTube channel. I'm also encouraging you to friend us on Facebook at FLM Family Life Ministries. Follow us on Instagram at FLMJA and subscribe to our YouTube channel, Family Life Ministries FLMJA. The numbers for the Family Life Ministries head office are 876-920-1034 or 876-926-8101. All right, so back to you, Dr. Leslie. What
Yeah.
is an edentulosness?
Ah, okay. Edentulosness. And that,
Edentulosness.
yes, edentulosness. And that's just a fancy way of saying you have no teeth. So
No
somebody
teeth.
who has no teeth is considered edentulous, right? No teeth.
Okay.
And we
Okay.
find that in the elderly, that's something that can happen,
Mhm.
especially if you have periodontal disease, right?
Okay.
There are other
Okay.
risk factors as well. I spoke about oral hygiene before, genetics, smoking, and also some of the medications that you may be on as an elderly
Right.
can lead to teeth being lost. But that
Right.
can be avoided if you have very regular dental care visits and
Okay.
also if you maintain adequate oral hygiene.
Okay. Okay. Now, what about gum disease? You mentioned that earlier.
Mhm.
What is it? How can we prevent it?
All right. Well, your teeth actually sit in the bone in your jaw,
Okay.
and it's held in place by ligaments called periodontal ligaments. And these ligaments adhere the roots of your teeth to the bone, and the entire structure is covered by gums. So
Right.
actually, when you look inside your mouth and you see teeth, about two-thirds of that tooth is actually under the gum, under the bone. Now, if you're not brushing your teeth adequately or properly,
Yeah.
in addition to you not flossing regularly, we recommend flossing between the teeth once a day.
Okay.
Plaque, which has bacteria, can actually build up around the tooth, eventually can go under the gum line. Initially, it's something that's very reversible. It's a
Okay.
simple gingivitis, a cleaning, being more meticulous with your brushing and your flossing will get rid of it. However, if you allow that buildup to stay in place by not having regular cleanings or not brushing or flossing things away, your
Right.
saliva or spit in your mouth basically sends out minerals, and those
Okay.
minerals will harden that plaque,
Mhm.
and that hardened plaque will then attract more soft plaque, which hardens, and you
Right.
find that that buildup will actually lead to the deterioration of the foundations of the tooth. So you
Oh,
lose gum, you lose bone, you lose
mhm.
those periodontal ligaments I spoke about.
Right.
And what you have happening as a result is that teeth may start to get wobbly or shaky. And if
Okay.
it becomes so severe, the tooth can actually fall out. You can also have teeth moving apart. So usually before the periodontal or gum disease,
Mhm.
teeth will be close together, but because of the gum disease, foundation isn't there, so they move apart. So you get spaces
Oh.
between your teeth.
Mhm.
And like I said, if it continues, it may eventually lead to tooth loss.
Okay. Wow. Now, how often do you see gum disease in your practice?
Very often,
Wow.
very often,
Mhm.
right?
Okay,
And
so
many
it's a
persons
common
have
problem.
gum disease and
Yes.
they don't even know that they have gum disease, right? We
Mhm.
have hundreds of billions of persons all around the world with gum disease,
Right.
and we tend to see it more in the older population. But there are types of gum disease that you also see
Oh,
in young populations as well.
okay. What is
What
it? Go ahead.
Right. I was just saying that it's important that we don't ignore the signs
Right.
of gum disease. So shaky teeth is a big one,
Yeah.
but even a simple thing such as bleeding gums, that's a
Mhm.
sign that should not be ignored because
Okay.
healthy gums should not bleed when you brush them or when you floss them.
Yes.
And any bleeding from the gums is an indication that you need a dental care professional, dentist, hygienist, to
Right.
actually investigate and find out what's happening.
Okay. So if you have bleeding in the gums and you start to go to the dentist regularly, is that something that can be reversed? Is that at a stage where it's reversible?
Right. No, if the bleeding gums, it's just affecting the gums. That's
Mhm.
like general gingivitis.
Okay.
Having a cleaning every 6 months, doing your brushing, doing your flossing properly will
Mhm.
definitely reverse that gingivitis. If it is that you've lost a significant amount of supporting tissue around
Mhm.
the teeth, then we always say that the gum disease will then need to be managed, but
Okay.
it cannot be completely cured because
Okay.
oftentimes the amount of support that you have lost, um, it's not very easy to get that back. That's why preserving that smile is important so that you
Mhm.
don't get the gum disease.
Okay. And what about denture hygiene? So there's some of our elderly population would be wearing dentures.
Mhm.
What are some of the things that they need to be aware of in terms of hygiene of their dentures?
All right. So firstly, if you've lost one tooth or if you've lost many teeth, know
Mm-hmm.
that your dental health professional can replace those teeth. And of course, we have various categories of
Yes.
replacements from a denture, bridge work, implants and crowns, implants and bridges. You can replace teeth that are lost.
Okay. Okay.
If it is that you have chosen to wear a denture to replace your missing teeth, it's important that you care your denture. Reason being, flat bacteria, fungi can actually grow on the denture and can actually stick to the denture and can make the tissues where the denture rests, they can actually get inflamed. And
Okay.
sometimes that inflammation can get very severe and the patient may have, pain in the area or burning in the area. So
Okay.
the first thing is you do not sleep in your denture at night. The tissue, your gums, tissue in the palate,
Right.
they need some time for saliva which is very good in terms of maintaining the health of the
Okay.
gums and the tissue in the oral cavity. There needs to be a period of time where those when the gums get to bathe in that saliva. And if you wear your denture, of course, you're blocking that saliva from getting to the palate, the gums, and you're more
Okay.
likely to get that inflammation called
Mm,
denture stomatitis. So it's important to disinfect your denture at night
right.
while you sleep. And you can get a denture cleaner at a supermarket or pharmacy, or
Okay.
even some household products can help to disinfect the denture. Not too
Okay.
much water and a little bit of baking soda, water
Okay.
and a
Okay.
couple drops of vinegar, water
Mm.
and maybe one drop of bleach. Not too much because
Okay.
the bleach can actually remove. Say you have an acrylic denture, the bleach
Yeah.
can actually remove that pink in the denture if you use too
Too
much.
much.
The
Okay.
other
So
thing,
so the elderly
yeah.
who are on living on a meager pension, they can make it stretch with a little bit, but in
Which is
terms of the
one of
care
the
of the
challenges as you get up in age. You're more
right,
likely to be retired. You're more
right.
likely, as you said, to be on a meager pension. And the level of insurance in that cohort is a lot less than the
Right,
general population. And
right.
if you compare a pensioner in the country versus a pensioner in the town, you find that a pensioner in the country would have even less resources
Wow,
for oral health.
right. Wow. Now, what about non-communicable diseases and oral
Uh,
health?
all right, non-communicable diseases are chronic diseases that affect our over 65s
Okay.
primarily.
Yeah.
And this would include high blood pressure and diabetes are very
Yes.
big ones.
Right.
And, I alluded to the fact before that, there's a link between the mouth and the body. So having gum disease can even increase your risk of, say, heart attacks or stroke,
Right.
the first cardiovascular diseases. Now, when you have hypertension and diabetes, you tend to be on medications.
Yeah.
And these medications can actually affect the health of the gums, which is why we, especially as dental care professionals, we want to see our over 65 patients oftentimes a lot more often because
Right.
medications for high blood pressure, especially your diuretic medications for diabetes, can
Yes.
actually lead to a condition called dry mouth or xerostomia. And xerostomia increases your risk of gum disease and it also increases your risk of cavities happening in the mouth. Because remember,
Wow.
saliva is a protective thing.
Right.
It the teeth in minerals that help to keep the teeth healthy. So if there's less
Yes.
saliva, the teeth are not as protected. And you tend to see a lot more cavities in patients who
Yes.
have dry mouth, and especially in certain areas that you don't often see the cavities, such as like on the roots, because elderly patients oftentimes tend to have more what we call gingival recession, where the gums tend to pull away from the neck of the tooth and more of the
Okay.
root is exposed. And that
Okay.
can happen in lung disease. That can also happen if you're too aggressive in your
Mm.
toothbrushing. And
So
of
that's
course,
soft toothbrush.
right. And of course, if the roots are exposed, the root is a lot less mineralized, and so it cavities can happen at a faster
Right.
rate on the root if there's exposure.
Okay. Okay. Now, I just want to remind our listeners that you've been listening to and watching Family Time on Love 101 FM, YouTube, and Facebook channels. Love 101, Family Life Ministries is the producer of Family Time. And for our social media interaction, we want you to tell us as an elderly person, how are you taking care of your oral health? Let us know via WhatsApp text and voice notes. I understand that WhatsApp is back up, so let's try that out today. Not longer than 30 seconds though. And you're going to send those WhatsApp texts and voice notes to 876 997 3125. And you can also send a comment on the Love 101 Facebook page or call the studio lines at 876 968 8327 or 8 to participate. And as I mentioned, we're also on Facebook and YouTube Live. We want to hear from you. Don't go away. We're talking about oral health and the grants with Dr. Leslie Davis, and we'll continue to do so right after this break.
How to make your credit card work for you. Make sure you understand how your credit card works, especially the annual subscription fee, the interest and fees charged for late payments. Paying off your credit card in full builds a great reputation with your bank, and depending on your credit card, you can also enjoy rewards, such as travel points. Learn more about credit cards before you get one. This financial literacy tip was brought to you by Bank of Jamaica, building an inclusive economy.
The Ministry of Health and Wellness is urging Jamaicans to get vaccinated against COVID-19 with the AstraZeneca and Johnson & Johnson vaccines currently available. The next shipment of Pfizer vaccines will be given only to children 12 years and older and to those persons who are due their second dose. To register to become vaccinated, members of the public are encouraged to make their appointments online at moh.gov.jm or call the vaccination call center at 888-1-LOVE. That's 888-663-5683.
It's Lupus Awareness Month, and we here at the Family Station want to give you the 411 all you need to know on this disease. Tune in this Tuesday, October 5 at 5:30 p.m. for Campus Connection as we look at studying with lupus, the student story. We'll hear how they manage living with lupus. Can lupus affect their pursuit in education? How did their friends react to their diagnosis? What they can eat, what they can't eat, and so much more. Campus Connection this Tuesday, October 5, 5:30 p.m. as we zoom in on lupus, the student story. It's all happening here on the Family Station, Love 101.
Cause I got one from campus. We are got a lot from campus. Come on, tell me what.
Okay, welcome back to Family Time, and it is 5:58 p.m. You're tuned to Love 101. Family Time is brought to you by Family Life Ministries. Family Life Ministries provides counseling for people with all kinds of challenges from all walks of life. Listen out for our numbers in Kingston and Portmore. We'll give them at the end of this program. Remember, we are Facebook and YouTube Live, so tune in to the program via the Love 101 Facebook page and YouTube channel. Let me remind you of our social media requests today. We want to know, as an elderly person, how are you taking care of your oral health? And maybe if you're not an elderly person, what do you think you can do to assist an elderly person in the care of their own oral health? You can let us know that as well. WhatsApp your text and voice notes, not longer than 30 seconds, to 876-997-3125. Post on the Love 101 Facebook page or call the studio lines at 876-968-8327 to 8 to participate. Now we're going back to Dr. Leslie Davis, our guest. She strives to improve the oral health of those in Jamaica, especially those with special needs, such as the elderly. She currently works in private practice in Mandeville, Bright Smiles Dental. So, Dr. Davis, Dr. Leslie, nutrition and the elderly, and how does that impact dental and oral hygiene? I think we lost Dr. Leslie for a moment. Oh,
I'm
she's
here.
coming back. Okay, great. You're back. Did you hear the question?
No, I did not hear the question. Can you repeat
Okay,
it?
sure, no problem. So it's about nutrition and the elderly and how that impacts your dental hygiene.
Okay. Well, one of the challenges sometimes, especially when you lose teeth or you lose teeth early, you can't eat certain foods, and of
Mhm.
course, that change in diet can affect the health of your gums, for example, and your general well-being. We know that vitamin C is important for
Yes,
the health of the fibers that keep the teeth in your jawbone,
right,
because the periodontal fibers are made predominantly of made from collagen, and
okay,
it's also important, especially as an elderly person, to have a lot of roughage in the diet,
okay,
because that roughage, can help to actually, help to clean the surfaces of
okay,
teeth. Yeah.
great, yes,
We
yes,
find that especially elderly patients
mhm,
um, who have more of a processed diet or soft diet, they tend
yes,
to have more buildup than if the
mm,
diet is more varied and hard and crunchy.
right,
Of course, you need teeth, whether you've got even teeth or
the
you know,
dentures,
dental prosthesis that's needed
right,
by the people.
mhm, okay. Now, is it safe for the elderly to have tooth extractions?
Mhm. It is safe
Okay,
because, with everything that you do, you have to weigh risk versus benefit. So
right,
having a tooth that's abscessed because of a large cavity, or that's abscessed because of gum disease, having that level of infection there can
right,
make you unhealthy. So it is safe, right? And even going beyond local anesthesia, if it's somebody who needs to be sedated
mhm,
to have dental extractions done, that can happen because, of course, each patient would need to be properly assessed before they
okay,
do
okay.
their sedation.
So speaking of anesthesia, is there an increased sensitivity to drugs used in dentistry by the elderly?
Right.
Uh,
Define increased sensitivity.
Like, are they more likely to have side effects from the local
Mm-hmm.
anesthesia or any of the
Um,
products
I
used?
wouldn't say definitely more likely, because
Okay,
oftentimes as a dental care professional, you would, gauge how much anesthesia you need to give to a patient.
right,
Of
right,
course, as you get older, so in terms of how you clear food,
yeah,
how you clear drugs, such as in local anesthesia,
right,
that can slow down. So you can offset
okay,
that by decreasing
okay,
the amount of
the dosage.
anesthesia that you give.
Okay, okay. Now, should the elderly be going for dental visits more frequently than the younger population?
If the elderly, excuse me,
Should be
not hearing
going
you
to the
well.
dentist? Should the elderly be going to the dentist more frequently than members of the younger population?
Definitely,
How
definitely,
often?
because you're more prone to
Right,
dry mouth. You're more prone to gum disease.
right.
So, but some elderlies are out there doing, much better than the younger persons among us.
Okay,
So it's important to have that examination or assessment with your
okay,
dental care provider, and they will
okay,
come up with a recall visit timeline that's
Right.
suited for you and your
Okay.
particular case.
Okay. So it's on an individual basis. Now, are you actually seeing the elderly at the dentist? Like, are they going to the dentist? Because I know when funds are tight, dentistry, the oral health, maybe even the eye health are some of the first things to go. We tend to
Definitely,
try to cut those.
definitely.
So are elderly people going to the dentist?
Yes, they are. And living in Mandeville, we
Yeah,
know Mandeville is the town for
retirement
the
town of Jamaica.
um, a lot of retirees live in
Yes,
Mandeville. We do see them coming out for dental treatment. Sometimes too, you know, especially parents would put off placing emphasis on their oral health care, which we
yeah,
don't recommend.
right,
Um, they will, upon being retired, they will then place the focus on their oral health. Once the children are out of university and the house is
right,
built, and then they'll come in and they're like, Doc, I need to fix up my mouth.
right, right. Okay. Now, what about the elderly who have limited mobility or they may not be able to care for all of their needs? They may not be able to move around as much, and so sometimes these persons are going to need a little extra support. What are the potential physical, sensory, and cognitive impairments that are associated with aging that may make home oral care and patient education communication challenging? So it seems we have lost Dr. Leslie, but she is going to be coming back because the internet can sometimes give us a little challenge. Dr. Leslie, are you back with us?
I am back with you, Tamara.
Great, great. Now, what I was wondering, for elderly persons who may have limited mobility, what kind of adaptations can be made to give them support? Um, yeah, let's start there.
Okay, so the elderly have can have a lot of challenges, and lots of motor skills is one of them, and that could
Yes,
mean not being able to actually be mobile enough to actually visit a
yeah,
dental care facility, but it could also mean not being able to properly hold a toothbrush.
right.
In
Arthritis.
that, exactly, because you actually need to hold it and guide it around the surfaces of the teeth.
Yes,
In that case, I would definitely recommend a battery operated toothbrush that can actually aid in brushing
right.
up the teeth. And low motor skills can also affect the patient's ability to hold dental floss.
Right.
So using floss holders,
Yes.
whereas the floss is already like on a little stick, so it's easier for
Right.
you to guide the floss in between the teeth.
Right.
But these are just some of the challenges that could happen. Cognitive impairments tend to
Yeah.
happen in the
Okay.
elderly as well. We know some of these diseases of cognition, such as Alzheimer's and dementia.
Yes. Yes.
Memory loss tends to happen, and that can impact how somebody who is elderly, how they actually take care of the teeth because they forget how to. In that case, it's important that the
Somebody.
caregivers are actually empowered to maintain that
Right.
good level of oral hygiene.
Right.
The low cognition can also affect even how you communicate with the patient. So oftentimes you have to go around it or find out from the caregiver, how do you know that something isn't right? And they may let
Right.
you know, oh, when he or she tries to chew on a particular side, they don't like when the food goes on that side,
Yeah.
even if that particular elderly person is not able to verbalize any pain or
Right.
discomfort that they're feeling.
Okay. Okay. Are there any new or special measures being taken because of COVID-19?
Right. Coming to the dentist?
Yes.
Definitely, definitely.
So
If you look on the risk of contracting COVID-19 out of all professions, members of the dental care team are at the top of the list.
wow.
Dentists, oral surgeons, dental
Very
hygienists,
close and the mouth is
dental
open.
nurses, yes. And
Yes.
interestingly enough, a lot of studies see the dental assistants that,
Oh,
are like the bane of any practice because they, keep things disinfected and sterilized.
yeah.
They can be at risk. But we were
Mhm.
ahead of the game. We were ahead of the game in terms of wearing masks and
Right.
making sure we were gloved up. But no, it
Right.
is that we wear extra personal protective equipment, like
Right. Right.
shielding our eyes, covering our hair, ensuring that the clothes that we wear while we're performing clinical duties would
Yeah.
not be the clothes that we wear like on the road or around our families, for instance.
Yes. Right.
Um, in practice, we also utilize, you know, various um, say instruments or equipment
Yeah.
to help to offset any potential contaminants that could be
Right.
COVID, such as
Mhm.
UV air filters, that's one.
Okay.
Special suctions that do a good
Mhm.
job of, as soon as we spray or clean, then it just sucks everything away so that
Right.
there isn't anything in the air. But COVID-19 has definitely changed the way we practice, and I think um, that will happen even
Right.
when this pandemic is over. Mhm.
Mhm. We are all praying for it to be over.
Yeah. Mhm.
Yes. No, you mentioned the PPEs. Is a different PPE worn for each patient that you have contact with?
Oh, definitely,
Okay.
definitely. And
Okay.
don't be surprised if you turn up at your dentist now and you find that the cost of the dentistry
Oh,
has increased
mhm.
because, since COVID, everything has increased. And of
Right.
course, a lot of what we use in dentistry is disposable. And
Yes.
if it's not disposable, of course, it's to be able to be sterilized in
Sterilized.
some sort of way.
Yeah.
So, of course, glasses, face shields are washed
Yeah.
between each patient, and you change your disposable bone.
Yeah.
Yes, to keep
Okay.
everybody safe.
Do dentists do home visits for the elderly?
Hmm. I know I do some home
Okay.
visits, and
Mhm.
um, we need more, especially because we know that in this particular cohort, there are
Yes.
challenges with access. I mean, you
Right.
could be institutionalized in a nursing
Yes.
home and
Mhm.
you have no way of getting to the dentist. It could be that you're moribund, you're restricted to your bed, and that
Right.
may pose some challenges.
Mhm.
Being in a wheelchair,
Right.
it's always good as a healthcare professional to ensure that your practice is accessible. For example,
Right.
somebody who is in a wheelchair,
Yes.
and that's something to consider when starting any health practice.
Yes.
Is it accessible to everybody, even the
Mhm.
elderly?
Yes.
So there is a low level of home visits. The good thing about COVID, it has
Yes.
sort of opened up the world of possibilities.
Yes.
And hopefully we'll see more of that soon.
Mhm. Okay. So it's I believe it was always possible, but maybe COVID has kind of pushed us to
Yeah,
be more open to the
yeah.
need to do this
Mhm.
for our elderly persons. What about online consultations? Is that a possibility?
That's definitely, I mean, teledentistry, it's
Mhm.
very big right now because
Yes.
as well, us as dental care professionals, we want to lower our risk of contact with
Right.
patients. So sometimes even a telephone conversation, you can
Yes.
actually get the history of the pain, the patient's medical history, and based on that telephone conversation or telephone triage, you can
Right.
actually decide, does this patient need to come in, or is it something I can advise over the phone? Does this
Right.
patient need a prescription? I could phone in that prescription to
Yes.
a pharmacy of the patient's choice. And doing so, you can actually even send in a WhatsApp picture.
Yes.
I do a fair bit of that, right? And based on that, I can say, okay, you definitely need to come in. I may need an
Yes.
X-ray, but sometimes it could
Okay.
be, oh, that's the normal growth and development of your 2 or 3 year old. That's
Okay.
fine. Yeah, let's reassess it in 6 months. So
Okay. Okay.
teledentistry has actually ballooned because of
Yes.
this pandemic.
Okay. Want to remind our listeners that this is Family Time brought to you by Family Life Ministries FLM. FLM provides counseling for people with all kinds of challenges from all walks of life. Listen out for our numbers in Kingston and Portmore. We'll give them at the end of the program. Now remember to call our student lines at 876 968 327 and 876-968-8328. We want to hear your thoughts on, as an elderly person, how are you taking care of your oral health? Or if you're not elderly, how are you giving support to an elderly person in the care of their dental hygiene, their oral health, right? WhatsApp your text and voice notes not longer than 30 seconds to 876-997-3125. Post on the Love 101 Facebook page, and we will definitely be sharing your thoughts as you share them with us. Now, Dr. Leslie, what about, here we go, the regular dental visits? How can the family give support to elderly persons in ensuring that they keep up their oral hygiene? They go to the dentist regularly, they are using their toothbrush the proper way, just monitor that, because maybe the elderly person might not be willing to admit or say that they need help in this
Exactly.
area.
Hmm.
What
Well,
kind of
it's very important that, that the whole family gets involved.
yeah.
Just as they say, once
Hmm.
a man, twice a child.
Yes.
So at the later years of life, oftentimes you may need assistance, and you may need assistance with brushing the teeth, flossing the
Yes.
teeth, and also in general paying attention to those in our household or families who may be over 65. It doesn't mean you can still be living a full and fruitful life
Right.
at
Right.
65. you know I have a lot of my older patients. I say, when I grow up, I want to be just like you, because you're living your best life at that age. So it's
Mhm.
important as a family to pay attention to
Yes.
the needs of the elderly. Any change in pattern,
Yeah.
complaining of pain, not eating certain foods again, not
Mhm.
wanting to wear a denture that they used to wear. It may not be fitting
Yeah.
as well because a tooth has moved or the denture
Right.
isn't fitting as well. It's important that you get that checkup so you can be adequately advised.
Right. Right. Now, without sharing any names or identifying information, can you share with us the worst case that you've seen,
Hmm.
with an elderly person and how it was resolved?
Hmm. The worst.
If it's not the worst,
But
one of
we
the
love all
worst.
our cases. And I would say that, I wouldn't term it the worst case, but I
Okay.
mean, sometimes there are challenges as
Mhm.
it relates to finances.
Okay.
Sometimes there are challenges as it pertains to, children may not want to spend, X amount of money on, say, grandpa, you know.
Right.
So sometimes just opening the lines of communication to say, well,
Yes.
you see why grandpa is losing weight? He really needs that denture, that he can't eat properly. And
Yeah.
that's why he's losing so much weight. And that's why he's
Mhm.
not, you know, up in mentality and in his physical form. So, having that conversation oftentimes can help to achieve the goal, which
Yeah.
is improving oral health.
Mhm. So, what about the the caregivers? Sometimes there are caregivers in the home. Are they trained to identify the oral health needs so that they can say, I think this one needs a follow up by a dentist,
Some
apart
are
from the
trained,
regular to go and check, for your regular checkups, but
right?
they're able to identify, they're trained.
Some are trained, and but we need more training. We need more training. And if you are a ward at a nursing home or even a children's home, or if you know are moribund, then it's important that you actually, if you work at any of these places or you're moribund, you can actually invite the dentist in or have a conversation with the dentist about how best to actually help to improve the oral
Oh,
health in the home or in the home if the person is moribund. No, I challenge dental health professionals as well. You operate in a community and there are, elderly homes, nursing homes around you.
right.
You can always depend on churches as well to say, okay, who are those persons in this community who, don't come out and they're shut in? And
Right.
you can, go in and offer basic advice or even a basic exam.
Okay. Okay. Is it a part of the, I guess, like the ethical obligation of dentists to provide pro bono work to
Okay,
the
sorry,
community?
Tamai, I'm not hearing you.
Okay. Is it a part of the ethical standard or expectation of dentists that they will provide pro bono work in their community?
If it's the ethical standard to provide care for the elderly,
No, not care for the elderly. Uh, Pro bono work. So to give some of their hours to we've lost Dr. Leslie, but what I'm getting at is that there's some professions where uh, it is encouraged, and it is an almost an ethical expectation that some of your work will be done for free. And so I was wondering, Dr. Leslie, you're back with us. Great.
yes, sorry about that. The
Yeah,
internet is being a little crazy. Could you repeat the question, please?
sure. So in some professions, there is an expectation, whether written or unwritten, unspoken, that you will give some of your time for free, some of your expertise for free.
Hmm.
Is that an expectation in the dental profession that you will do some pro bono work?
All right. I mean, especially in a Jamaican context,
Yes.
many of our population would have economic challenges. We see
Yeah.
that in the elderly. We also see that in the non-elderly. The
Right.
government services do offer some level of care, but it's not on a grand and varied scale.
Right.
So a lot of private practitioners do offer pro bono work in terms of helping to alleviate the burden of dental diseases in that population. And we know that persons who tend to, have less money, unfortunately, also have more disease.
Yes. Yeah. Now, what about persons who don't like going to the dentist? So maybe,
Mhm.
it's from childhood, they had some traumatic experience and they don't like going to the
Mhm.
dentist, and, they would rather lose a tooth
Yeah.
than
I
have to go to the dentist.
always.
What kind of advice do you have for them or for persons
Mhm.
who need to take those elderly persons to the dentist?
Right. And I mean, dentistry has changed so
Hmm.
much. I
Yeah.
mean, you should never let an experience that happened 40, 30 years ago prevent you
Yeah.
from going to the dentist now, because dentistry of today is different.
Hmm.
We understand the fear,
Yeah.
and of course, there are ways to go around the fear, right?
Yeah.
And you find a dentist that you're comfortable with,
Yeah.
one who can listen to your concerns about
Hmm.
fear, and one who can help you to alleviate those fears so that it doesn't come in the way of your oral health being at the best that it can be.
Right, right. Apart from being comfortable with the dentist and one who is willing to communicate with you and help to alleviate the fears, are there any other things that people should be looking for when they're trying to find a new
Mhm.
dentist?
Right. Well, I think demeanor, like I say, it's one.
Yeah.
We paint some fun colors in the upper tree to sort of help you to feel relaxed.
Mhm.
Play some soothing music. If it's a child, we may want to have some cartoon characters, or a screen so they can watch, their favorite
Right.
cartoon to help
Yes.
relax them. And
Yeah.
just understanding the fear,
Right.
and being gentle is
Mm.
something that can help a patient who was otherwise apprehensive to actually come
Right.
around and enjoy going to the dentist.
Hmm.
Right? I see that happen so many times.
Yeah.
It's just a matter of you know um, communicating as well, like I said,
Okay.
and getting to understand the fear. No, the needle is not as big as an elephant. People have all, Jamaicans especially, we have a
Yeah.
lot of
Sometimes we like to
myths.
scare people.
Yes.
In our culture, we like to
Mhm.
so we say, well, and we
Yeah.
exaggerate and we talk. So you
Right.
say a needle big like an elephant, and that way
Yeah.
one person's experience, and the
Or
person is really
we
just dramatic.
threaten taking children to the
The
dentist so the
dentist as
dentist can take
punishment.
out their teeth. And I'm
Yes,
like, so they think, oh my, it must be an awful place if I'm
yes,
being threatened to go there. We have to be
yes,
careful what we say around children as well,
right.
because
And these
fear is
things
not
linger into their
something you're born
adulthood and
with.
elderliness.
Yes, fear is something that's learned based
Right.
on your experience, or you heard that somebody said something. Oftentimes
Right.
a patient would come in and I'm like, oh, sunshiny day at the office. And I go in with a bright smile. I'm like, good morning. And it's like, I hate the dentist. And I'm like, what did I
Yeah.
do? Why do you hate the dentist? And sometimes, interestingly enough, you would hear, I've never been to the dentist and I hate the dentist.
Yeah.
So oftentimes we
The
have to
stories.
circumvent that
Mhm.
fear. And I
Okay.
always say
It's
persons who don't like the dentist should see their dentist more often so that we
they
can
don't
keep
need
a
to go.
close look on
Yes.
things, and we can treat things when they're small, when
Right.
they're cheaper to treat, and also we can treat them in a less invasive way.
Okay. How can we know if a dentist is licensed in Jamaica to practice?
Okay. The Dental Council of Jamaica registers all practicing dentists.
Yes.
You can call them, or you can check out their website, and that will give you a list of qualified dental practitioners.
Okay. Okay. All right. Thank you so much, Dr. Leslie, for being here with us. And thank you to our listeners. If you have questions of a personal nature, or you're concerned about a family or a friend, we want you to call Family Life Ministries. You can call our office in Portmore at 117 Cecile Avenue. It's 876-939-7917. For more information on our services or for our counselors in Kingston and other parts of the island, contact our head office at 876-920-1034 or 926-8101. Note that appointments can only be made by calling the offices. Otherwise, to keep up to date with what's happening with Family Life Ministries and our programs, find us on Facebook at Family Life Ministries, FLM Family Life Ministries, on Instagram at FLMJA, and subscribe to our YouTube channel, Family Life Ministries FLMJA. Before we leave you, here is this evening's verse. Glorify the Lord with me. Let us exalt his name forever and together. Psalm 34, verse 3. Join us again next week at 5:30 on Love 101 FM. And thanks again to our special guest, Dr. Leslie Davis, our studio facilitator, Rasheen Douglas, Kathy Hale of Open Door Communications, and of course to you and Tamaya Wilson. Stay well, stay safe, stay blessed.